is Catherine Simaloi. Now, Kenya is stepping up its fight against malaria, even as the country records gradual progress in reducing infections and deaths. Health officials caution that the disease remains a major public health threat, with millions of people still at risk. Our reporter Faith Wangari breaks it down.
Mosquito kidogo tu inatuchenga. Na venye tumesoma. No, I think it is the high time we said no malaria in Kenya.
Kenya has made significant progress in reducing malaria infections, with prevalence dropping from 8% in 2015 to 6% in 2022, a milestone attributed to sustained disease control efforts. However, malaria remains a major public health challenge. Data shows that in 2024, Kenya recorded 4 million malaria cases, with 75% of the population still at risk of infection. The disease also accounts for 18% of patients seeking treatment in public health facilities.
Our solutions must be locally led and sustained. This requires deep domestic investment into our country and to the system. And I want to commit from the national government, our counter funding for malaria will stay.
The Ministry of Health is now targeting an 80% reduction in malaria cases and a 90% reduction in deaths through comprehensive prevention and treatment strategies.
We have reduced our malaria burden from the very many years behind when it was very high. Specifically in Kisumu County, we've been able to reduce malaria from 38%, that was in 2015, to around 15% according to the Kenya Malaria Indicator Survey of 2015.
Despite these gains, experts warn that malaria parasites continue to evolve, threatening the effectiveness of existing drugs. Kenya is among the few countries implementing multiple first-line treatment strategies, beginning in high-burden counties such as Baringo, Busia, Kakamega, and Siaya before expanding nationwide. However, misuse of medication remains a major challenge, contributing to drug resistance.
We have very few drugs remaining. I think in the country we only have 4 different types of products, particularly maybe between 4 and 6. And if we are not able to use these drugs properly, then we get resistance to drug treatment, and we get a lot more malaria if that is not managed.
Community health workers are expected to play a key role in educating the public on proper drug use and prevention methods. In high-risk areas such as Turkana, targeted interventions are ongoing, focusing on preventive treatments for children at risk before infection occurs. Over 82,000 children were reached in 2024 in Turkana, with a targeted of 135,000 children this year.
Turkana County has a population of more than 1.2 million people, and we realized that more than 550,000 within a year actually cases of malaria reporting to the facility. And that is more than 50% of all cases